somebody has just brought you in. याद है यार हमारी नजर हुए वो बोल दो तो साथ में चले.
So here, okay, yes, yeah. Can you stand up? Yeah, that topic, yes, yes. What is the name of my topic? What's the title of my topic today? So, okay, thank you. Shoulder to hand, what is hot and what is not. The first thing when you are in any talk is to be aware of what is going to be talked about. Because otherwise, what is talking about. Now, I will not start with shoulder and hand. I will start with the idea of what is hot and what is not. So, if you look at the Google or if you go to the real world, does any of you know what is the title of the most popular talks on the face of this planet? It's made up only 3 letters. Does everybody know that? Has anybody heard of TED Talks? TED?
Yes, sir.
How many have heard? Properly ask the children. You are a physiotherapist. The range of movement is your goal in life. Okay. Okay. जे अर्धो हाथ ऊंचा कर से ने ऊपर देके जवाब आपको कर से. Okay. So okay, the guy in the yellow shirt. So what's the full form of TED? TED. So in this world at the moment, TED Talk is the most popular and subscribed talk platform on technology, entertainment and design. That's what defines the 21st century, whether you live in Gandhinagar, whether you live in Georgia, whether you live in Gurgaon or wherever. And majority of the TED Talks are done without PowerPoint. So I used to use PowerPoint when I was a baby. Well, not really. There wasn't even a computer yet, but when I was a baby medical student or a baby resident, even as a resident doctor, you are still a baby in your field. So then I realized that what I am showing on PowerPoint, you can find on Google, you can find in your textbooks. So I thought, and I do a lot of talks. So every year I go to London and I have 5 or 6 workshops and talks lined up in various parts of the world. One place I don't do very much talking is Ahmedabad. Because in Ahmedabad everybody likes to see the work, not the talk. It's a different city to any other city in the world. So that's why it's going to be interactive talk. So that is actually the concept that you have to understand, and that's what is actually hot at the moment. You do the talk without the PowerPoint. The second thing which all of you must be aware of is something called AI. Does anybody know what AI is? What is that young girl was yawning just now? Stand up. What does AI stand for? घर में मम्मी के साथ आर्ग्यूमेंट के टाइम जितना बड़ा आवाज होता है ऐसा आवाज करो. What does AI stand for? Anybody else? Yes? Artificial intelligence. Okay, I'll tell you something which is even hotter than artificial intelligence. It is called RI. Has anybody heard of RI? I don't think so. It is something that I have made up. So, RI is real intelligence. So, even to run AI, you always have to use RI. So, people are worried that radiologists will lose their jobs if AI comes in, or if robotics comes in, orthopedic surgeons will lose their job of doing knee replacement or arthroscopy. No, because RI will always be above the AI. So remember that AI is cool, but RI will always be hot. Okay? Okay. Now the third thing. Have you, and each of the topics I am talking about has a relevance to the actual orthopedics, which they have given it 45 minutes. So I can't be just showing you slides, because we will all fall asleep or start yawning like you were doing. So the next thing is VR. Has everybody heard of VR? Anybody heard of VR? The faculties are very, that's why they are faculties. But about the students, has anybody heard of VR? Okay. VR is virtual reality. Okay. Has anybody used the VR goggles? Now there is something which is RR. Now you know what RR is. real reality. Okay? And when you are using virtual reality, you can't get rid of real reality. I'll give you a real example. So there is one of the introductory points that was given was that I am a mentor at iHub, which is just around the corner in Gandhinagar. It's a 50 crore project by government of Gujarat. And all the young graduates, and that could be any of you, when they have an idea and they tell somebody in the college, their faculty or somebody, કે મને આવો કરો, અરે એવું તો બધું થિયરીમાં સારું લાગે, રિયલ વર્લ્ડમાં જોયું છે કેવી તકલીફ પડે. When somebody has that kind of experience, they go to iHub. Now I am a mentor for the health tech startup in iHub. So young boy came to me and with these goggles, okay, sir, તમે પહેરીને જો કેવું લાગે છે? iHub sent it to me. So I said, it's cool. He said, I want this to be used for those patients who are having fear during the MRI scan. Has anybody gone through MRI scan?
Yes.
Who has gone through MRI scan personally? Nobody? Okay, what was your experience? Bit scary, right? So, he designed MRI compatible virtual reality goggles, because in normal virtual reality goggles there is metal. And then, because I do a lot of shoulder injections, although I'm an orthopedic surgeon, I'm in that sweet spot of my career where you tell more and more patients not to have surgery. And you spend more and more time talking to them about how is your dog doing at home, or how is your daughter in Australia or America. And actually when you do that, half of that pain disappears. So there's the next hot thing that I'm going to give you a label about. So when we shoulder injections are very painful. Has anybody had a shoulder injection, or anybody in your family had a shoulder injection? So 80% of subacromial impingement pain patients, if it is diagnosed properly, okay, that's a big if. And I'll tell you about what are the painful shoulder conditions. In fact, you guys are going to give me the answer. Then I have developed, and I'm not trying to brag about it, it's just that I have developed a method called triple injection therapy for shoulder pain. And my results, and I tell this to my patients, in carefully chosen patients, are about 80 to 90% of them will have a lasting relief for years. And we have got patients to show that. And we just do it in the OPD. So, a lot of people have a lot of fear when they are having shoulder injections. It's a very sensitive area, especially the AC joint, correct? So when they wear these virtual reality goggles, they are in a different world and they don't realize. It's like they are having something else, which some of the people in the young generation might be aware, on the back side of some cafes. But anyway, so no, you all are good children, so you will not be aware. So, so some people are laughing, so that's fine. So the thing is that without taking any substance, if you can get rid of the apprehension and fear, isn't it an amazing thing? Because what is physiotherapy, what is orthopedics? Who comes to me as an orthopedic surgeon? Who comes to you as a physiotherapist? Somebody has got pain, knee pain. Of course, they might have sporting injury, they might get arthroscopy. But why do they come to you? Because they can't walk, they can't run, because it hurts. So when somebody see that is a very serious, that's the only reason that we exist as professionals, is to get rid of somebody's pain or the root cause of the pain. So that is the correct approach for. So when their apprehension goes away, half of their pain goes away, and you can do whatever you need to do fairly efficiently in a shorter time. Now I'll come to the shoulder condition, because the shoulder to hand is the end. Now I'm not going to teach you shoulder anatomy, 3 stages of frozen shoulder. I'm sure you all have been taught about that, correct? So if I'm going to repeat all that, I should not be here. However, if you remove fracture and cancers and septic joint, what are the causes of shoulder region pain? So I'm going to go around the audience. Like I said, the last second 50% of the rows is my favorite area of the audience. So can anybody stand up? Otherwise I'll make you stand up and give me one actual diagnosis of shoulder pain. This is the condition. Ane aache mate shoulder pain che. Anybody? So I'm not going to waste a lot of time and say, okay, there in this corner. Yes, you. Shoulder pain, any cause? Any diagnosis, any name? Anything you have heard? Anybody else? So, okay, everybody has heard of frozen shoulder, right? Right? How many of you have heard of something called periarthritis of the shoulder? Now, let me tell you, both these conditions do not exist. When I left India in 1989, everybody with shoulder pain was periarthritis of frozen shoulder. When I came back in 2017, it is still periarthritis of frozen shoulder. I feel really, really bad that the medical education, the orthopedic education, the physiotherapy education has not caught up with the concepts that are current and credible. So the concept doesn't have to be just current or new, they have to be credible. So I am going to give you a list of the conditions which actually exist and you should be able to diagnose clinically in your physio clinic. Then, with that knowledge, if you open a little physiotherapy clinic called shoulder physiotherapy clinic, I can guarantee you that you will have great success professionally as well as financially. So one condition is called adhesive capsulitis, which used to be known as frozen shoulder. Has anybody heard of adhesive capsulitis? Yes. Now, what causes adhesive capsulitis? What happens? Does anybody know what happens in adhesive capsulitis? How? Okay, you were saying something. Stand up. Yes, yes. Muscle stiff हो जाता है. Shoulder joint. Okay. So actually you are nearly right, but not completely. Muscles don't become stiff. The shoulder capsule becomes stiff. So that is what. And why does it happen? How does it happen? Any idea? So there is something. There are 2 or 3 reasons why it is believed it might be happening, although we don't know. One is an autoimmune condition. Okay, like Dupuytren's disease. The second thing is something called fibroproliferative growth in the capsule. We don't know the cause of it. It could be autoimmune or it could be spontaneous. Third thing is infection. You know, like in ulcer, we used to treat just antacid. Then somebody found out that there is a bacterium called H. pylori. Similarly, some people did research and found some bacteria in the axilla. And they believe that this bacteria might be actually going in the shoulder and causing the reaction in the capsule. And currently the work is being done at research level to see if we can actually prevent progression of adhesive capsulitis with targeted antibiotics even. But it's not yet in clinical practice. Then another thing which is actually most relevant here in Gujarat in particular, કારણ કે દાળમાં પણ ઢગલાબંધ ખાંડ નાખવામાં આવે છે. Yes or no? એટલે everybody comes to Gujarat finds that તમારા ગુજરાતી લોકો મીઠા બહુ છે. એ તો ધ્યાન રાખજો. એટલે and I tell you why it is very close to my heart when I am standing in this piece of land. I did my internship after MBBS in the civil hospital Gandhinagar. I grew up in Gandhinagar. ગાંધીનગરના આંબાઓ પરથી પથરા મારીને કેરીઓ પાડીને અમે ઉનાળામાં કેરી ખાતા હતા. બરાબર, અમારે કેરીના ટોપલાની જરૂર પડતી. So you can imagine what is my Gandhinagari St. Xavier School my study, Gujarati medium. Very proud of Gujarati medium. Okay? So any of you who is in Gujarati medium, don't feel you are any inferior. Okay? In fact, you are superior because you are in touch with your real self if you are in Gujarati medium. So the thing is, when I was in intern with Dr. Paresh Vora, I think was the chief physician in Gandhinagar Civil Hospital, he's still around, I think not practicing. I saw a lot of patients with diabetes and blood pressure in his clinic. So I said, let me do a survey in the clinic. And I found, so I had that kind of habit. And I got a medical student from Australia with me. So she is in the Bangalore Medical University, which is the biggest private medical school in Australia. And I'm an honorary adjunct associate professor there. So the students come here in Ahmedabad. They spend 2 weeks with me. But she's doing actually 6 weeks orthopedic research project with me. So I've been interested in doing surveys of research from the very beginning. And I found out that 65% of patients who come to the OPD, you must tell me 5 minutes before my time is about to finish. 11:45 is my finishing time. Tell me 5 minutes before that. So 65% of the patients had diabetes or blood pressure or both. 65%. And how that was in 1984-85, where most of you, maybe even not of a lot of your faculty was even born, right? So in diabetes, there is a very, very high prevalence of frozen shoulder, or what is known as an adhesive capsulitis. And why it is important? Why do you think it is important to know in somebody with adhesive capsulitis whether they have diabetes or not? Why is it important to know that? Any guess? Anybody? Because the result of physiotherapy, the result of manipulation under anesthetic, the result of injection treatment, all is inferior in frozen adhesive capsulitis shoulder pain with diabetes as compared to somebody without diabetes. Now, if you did not know that, and you will just keep on treating them with physiotherapy, the patient will end up with somebody like me, physiotherapy is to badhare dukha. In diabetes patients with adhesive capsulitis, a lot of times, I am not saying always, physiotherapy doesn't work. In a lot of patients, it doesn't cure it. And I have treated doctors like that. I have treated physiotherapists like that. But in adhesive capsulitis without diabetes, you guys have a great role to play. Okay? So, and in small percentage of patients, whichever type of problem it is, sometimes orthopedic surgery fails, right? We have seen patients with knee replacement who are still in pain, right? So we are not above you. Okay? We are just with you. We are one of the options. And you are also one of the options. And as options, we have to work together, not your orthopedic surgeon पास ना जाता है तो सुवाड़ी दे सकते, right? कि physiotherapist पास ना जाता है तो तुमने 20 की ओछा सेशन इतना छोड़ से नहीं, तुमने ये वो नवो concept खोलियो છે કે सीधा 2 लाख લઈને પછી દાખલ કરી દે અને physiotherapy કરાવે. સાંભળ્યું છે એવું? I don't know. મને કઈ ખબર નથી. But what I am saying is, rather than doing that, if we work together and if we know what we are doing, then we can at correct time guide the patient correctly. When you are patient, आपको family member है जो, we don't want them to get lost. So, shoulder tear, I have talked about only one condition for last 10 minutes, adhesive capsulitis. So, can you imagine how detailed this joint is? So, what are the other conditions? There are 7 or 8, but I'm not going to talk more about the others. So, you heard of subacromial bursitis? Yes. So, what happens in subacromial bursitis? Anybody? Gujarati, Hindi, English, Tamil, Malayalam, Telugu, Marathi, Bengali, French, Spanish, any language. What happens?
Inflammation of the bursa.
Inflammation of the bursa. Good. So that bursa is between the rotator cuff and the acromion. And it gets inflamed for whatever reason. Okay? So that's subacromial bursitis. Then you have got something called subacromial impingement, with or without bursitis, where the undersurface of the acromion has become thick. or it has become curved. So it's a bony problem leading to secondary bursitis. So that's the third cause. Fourth cause is AC joint arthritis. You heard of that? Fifth cause is tendinosis of long head of biceps. Please keep on counting, okay? Somebody is doing a YouTube live of these talks, so I'll share the link with you, so you don't have to write everything. I'd rather you are more interactive. So, long head of biceps, tendinosis. How do you diagnose long head of biceps problem? Anybody? Has anybody heard of O'Brien's test? Empty can and so the guy who gave us this test was a surgeon called Dr. O'Brien from USA. And I had the good privilege of learning the O'Brien's test from Dr. O'Brien himself. That's the reason I went abroad. I didn't go abroad because I saw Shah Rukh Khan dancing on the streets of London or Hrithik Roshan or anybody else. I went because for allopathic sciences, they are the source of knowledge. Origin of the knowledge is in the Western world. We can't deny that. Just like Ayurveda and Yoga, the origin source is Bharat. And we should be proud of it. But original sources in those countries. So I went and worked in England in each and every hospital. For example, in the hip fracture, there is something called Gardner's classification, which tells you what we should do. So I went to the same operating theatre where Dr. Gardner was practicing in Preston, near Manchester. Or the hospital in Wrightington, where the first knee replacement was ever done on the face of this planet by Sir John Chanley. So I always wanted to go to the Gangotri of knowledge. That's what you should develop as an that is hot. Is not hot. Although in the young generation that is considered, what is the word is swag, isn't it? Have you heard that word? That's not swag. Going to the root source of knowledge is the swag. So now I know an orthopedic surgeon in London whose entire orthopedic practice, not just in shoulder, is only on long head of biceps. He only treats long head of biceps pathology. Another colleague of mine treats only the patellofemoral joint, not even the knee joint. Another colleague treats only soft tissue of the knee, so no knee replacement, only soft tissue, no osteotomy. Only if there is a soft tissue problem, we will treat them. So you see, this is how advanced the medical knowledge has become. So I was going to long head of biceps and the original source, O'Brien's test. Then what is the next one? Rotator cuff tendinosis. Rotator cuff tear, right? Calcific tendinosis. Anybody aware of calcific tendinitis of rotator cuff? Is the most severely painful condition of the shoulder. And it is literally hot. And it feels like a septic joint. And you can see a big blob of calcium on the X-ray. And it responds to steroid injection. That's why the steroid injection is most indicated. Just like saving some people's life in COVID, steroid injection was required. They may develop a muscular necrosis, osteonecrosis in the hip afterwards, but they are alive. Right? So you use steroid when there is no other option. So calcific tendinosis. Any other condition you can think of in shoulder? So osteoarthritis of the glenohumeral joint. Right? And then you have your septic joint tumor fractures. And last one which I have not mentioned and none of you are probably thinking is called instability. Now shoulder dislocation everybody knows. But a lot of patients, the young males in particular after shoulder dislocation will have shoulder instability. Because the labrum, if it is displaced, it will never jump back to its original place and it will keep on causing instability. And each of these conditions can be diagnosed by proper history taking and clinical examination only. You don't need ultrasound, you need X-ray to make sure you're not missing on something, and I'll give you an example of that. You don't need ultrasound scan, you don't need MRI scan. But you need those investigations when you are going to finalize the treatment. You don't need the scan because you don't know the diagnosis and you want somehow the scan to do your work, which you should be doing as a clinician, whether a physiotherapist or an orthopedic surgeon. Okay? And there are studies to show that shoulder treatment, subacromial impingement pain, patients treated with or without MRI scan have the same results. Now coming to the physiotherapy side, what is important? And I'll give you an example of a famous Indian cricketer, Riddhiman Saha. Has anybody heard his name? Now he developed a thumb fracture. Does anybody know about that? Some time ago. He was being treated in National Cricket Academy in Bangalore. And obviously the physiotherapist was very keen that we should strengthen his upper limb. That's the right thing to do. But the over-enthusiastic rehabilitation led to shoulder problems, which was not diagnosed. And he went to England to play. I say he couldn't play. The diagnosed that he had complex rotator cuff and lateral tears in his shoulder from fully back to the same level. So when you are doing rehab, just make sure that you are not overdoing it. Because sometimes when you are young, it is very difficult. Just sitting with the patient or standing with the patient and doing nothing is actually the best thing. They will thank you for that. But you must learn the art of doing nothing. Doing nothing out of ignorance is different, and doing nothing because you know that you are not doing anything because you want to harm the patient and give them other options is a different thing. That particular thing you have to remember for the rehabilitation side of things. So another thing I will briefly touch upon, tell me 5 minutes before my time. So you all have heard of tennis elbow? Okay. Now I'm going to introduce a word which you all should know when you are looking at any condition, treating any patient. And that word is prevalence. Has anybody heard the word prevalence? What does it mean? Anybody volunteer to stand up and tell me what prevalence means? Yes, yes, sir.
Already there.
Already there. So, okay. So you are also already there. So the number of people who have that condition in a community, in a town, in a country, that is the prevalence of that condition. Okay. So, what is the prevalence of shoulder pain in India, do you think? What percentage of people must be suffering from it? And you just randomly survey people in Ahmedabad. Khabab. Make a guesswork. I am not going to mark you or anything. In fact, I will appreciate even if you give a wrong answer. Because there is no stupid answer, there is only stupid question. So she is saying 57%. Okay, diabetes patients, you are right. But people without diabetes? So anywhere between 25 to 40% of people will have shoulder and shoulder related pain. Now if you know this, just imagine what's the population of Ahmedabad? Anybody? Come on. Ahmedabad की बस्ती कितनी है? 80 lakhs. What is 25% of that? चौथा भाग में अहमदाबाद 20 चौकों की ऐसे आगे ना गुजराती मीडियम तो कौन चाहता होगा 20 चौकों कितना था 20 लाख लोगों अहमदाबाद में गमे तेरा शोल्डर पेन की सफर करता है can you just imagine the pool of patients that you can have but look at it at a higher level how many people's life you can improve right. So always consider money as your byproduct. Okay? That is a smart and ethical way to earn money. When you mix ethics with smartness, it is okay, it is allowed. So tennis elbow, what must be the prevalence of tennis elbow? Anybody just make a guess, give me a random number. What percentage of people? So 1 to 3%, तो 2% of अहमदाबाद बच्चे को आंकड़ों लेने चाहिए. That is 1,60,000 लोगों અત્યારે ટેનિસ એલ્બો લઈને ફરતા હશે. કેટલા? So if you become an operative physiotherapist, what will happen? All these people will come to you because you will be the first operative physiotherapist of Gujarat. Yes or no? Is it cool or is it hot to be the first one, the pioneer one, with no competition? Or is it cool and smart and hot to be one of the 2000 ones? And then saying, "Mara physical condition, Mara approach, Mara take condition." Everybody wants to do the same thing. If you, any condition, just go through this prevalence of that condition, then you will know the bulk of patients who are suffering from that condition, and you can actually target so many people with that condition. You can help them. So there is a video of one of my tennis 5 minutes. So I'll show you a tennis elbow patient video. If you just scroll. Yeah, you have to keep on. I used to have beard at one stage in my life. Okay, that's the one. So she's not my patient, by the way. Okay, just what if you
टेनिस एल्बो जो एल्बो के साइड में काफी दर्द होता है और इनिशियल सावर के बाद फिर एडवांस सर्जरी करी दोनों एल्बोस को बाइपोलर रेडियो फ्रीक्वेंसी पॉपुलेशन होते हैं और साथ में एल्बो की टिश्यू का भी रिपेयर किया।
वहाँ भी मैंने ऑपरेशन किया और आज 3 साल हो गए दोनों हाथों कोई प्रॉब्लम नहीं है, कुछ भी काम कर सकती हूँ, कहीं पे भी जा सकती हूँ। मैंने ट्रैकिंग भी किया है, हर साल मैं 3-4 दिन के लिए ट्रैकिंग में जाती हूँ हिमाचल उत्तराखंड। वहाँ पे भी मुझे कुछ प्रॉब्लम नहीं है, चाहे कितनी भी खंडर कितना भी काम कर आए।
So the treatment that we gave to, she tried everything, of course. I never do operation in tennis elbow except as a very last resort, probably 5 to 10% of patients. But the statistics, and you must keep in touch with the recent data, that 20% of tennis elbow patients don't get better with injection, with physiotherapy, with splints, with medication, anything. So this 20%, something else might be needed. The treatment that we pioneered, which I used to, we started in US in the year 2004 actually, is called bipolar radio frequency copulation. It's a very precise technique. And so I was doing it in UK when I was there, and then I brought it with me to India in 2017. And in carefully selected patients, we do that treatment for tennis elbow. So that's the latest treatment you can think of. And the other things which we use for tennis elbow nowadays, other than steroid injection, is the advanced platelet-rich plasma injection. But every PRP is not the same. Okay? So there is different PRP for the knee cartilage, and there is different PRP for the tennis elbow muscle and ligament. So the person who is doing it needs to have that knowledge and the latest evidence of, because the technology and the knowledge is developing all the time. So that's the other hot thing to do, is to remain in touch with the latest evidence from credible sources. That gives you an edge over, well, if you are in competition, then over your competitors, but that gives you an edge in terms of giving the best to your patients. Last 1 or 2 things. There is something, the thumb arthritis, very common in Indian women in their 50s, and there is a very definitive treatment for that if everything fails, and we do that, but I will not show the videos. I've got too many videos. You can link with my YouTube channel and find out. So that is a condition you should be aware of. Decurrent tenosynovitis, you must be aware, and we use ultrasound guided injection if nothing works. So these are the kind of things. But one final thing I would like to mention is something which is very contemporary in the medical field. It's called human factors. Has anybody heard of that? Human factors? So human factors is not just about being nice to somebody. It is part of that. And when we say somebody, you start with your colleagues. Because the most difficult thing in life is to be nice to somebody who is with you, working with you. You can be nice to a stranger on Facebook, Insta. What else is there? Tinder? Never used it. Trust me. So anyway, looking at my face, it won't work. So the thing is, we can be nice to strangers nowadays, isn't it? But we can't be nice to people around us. First, learn to be nice to people around you. And I have physiotherapy students coming from Kathy College. Dr. Mansi and her team have done amazing work with that. And LJ, and you know, so somebody like him, so I said, he's the patient. I said, talk to him. So he said, Su Thai, Kathy Thai. I said, no, what will you say first? So okay, so what should you say first to your patient? Anybody? Okay, so then?
Good morning, good afternoon.
Chalo, greeting then. Maru Naam. Tell your name. Then ask the patient his or her name. અહીંયા આપણા દેશમાં ઇંગ્લેન્ડમાં તમે પેશન્ટનું નામ ના પૂછી શકો આજની તારીખમાં. You know why? Because they have gone, and I'm saying it from open minds, the Western world has gone crazy with the idea of gender. Don't fall a victim to that nonsense. But in India, we still have common sense. So you can say man and man, woman and woman, because that's how the nature has made us. So they have gone mad. And Vivek Ramaswamy was the President Trump's co-runner, has openly said it. And but here, always ask the patient his or her name. Two things you do: be nice to your colleagues, always be punctual, always be transparent, always be on time, and ethical. These are the human factors. And talk. Okay, don't ignore people, because talking solves a lot of problems. These human factors are known to reduce risk of complications in operation theaters as well, because surgeons are the worst in human factors. So don't learn bad habits. Learn about human factors. Google it. Somebody just did a PhD in England about it, one of my colleagues. So these are the random thoughts I have shared with you in a kind of Ahmedabad improvised TED talk. Any questions, you need to contact me anytime. I'm sure there are a lot of people here who will know how to contact me. Bharat Mata ki Jai.
Thank you, sir, for imparting us with life-changing wisdom and knowledge and shedding light on things which I'm quite sure will benefit us to great length. Now, I would like to request Dr. Orthopaedic to felicitate Dr. Keyur Buch, sir, with a token of gratitude.